know that how to do that.
Good afternoon. Welcome to Age Strong, Live Long, a summit on our aging population. My name is Ron Roberts, and I'm proud to be serving as mayor of Temecula for the 5th time this year. Yeah, it's a record, but don't worry about it. I got over it a long time ago. Today marks the accumulation of many discussions and a lot of planning for a conference addressing the realities facing our nation and local community as we grow older and live longer. As a senior myself, the trends for today's active adults and the awareness and access to services, including transit, medical, housing, and leisure, are extremely important to me, and I know they must be important to you also. We have assembled an expert panel here that will be educating us all with staggering statistics, forecasted trends, and practical advice and wisdom as we get older, assist loved ones, and identify key resources to help us in our lives. And don't forget, after this is over, we will still have 33 specialty vendors assembled in front of the Civic Center with great information. So please be sure to visit each of these service groups. And in addition, we'll be providing food and refreshments at the conclusion of this panel discussion, and hope to visit with you then. That'll be right across the hall here. Again, welcome to this event, and thank you for attending today, and I trust this will be a valuable experience for all of you. Now at this time, I'd like to introduce our MC for the afternoon, my colleague on the City Council, Temecula Mayor Pro Tem Chuck Washington, and no, he is not my son or my brother, as he will tell you.
Thank you, Mr. Mayor. He's got a good sense of humor. He puts up with me. He likes to share with folks that he is the only 5-time mayor, but I like to tease him that he's also holds the record for saying he's not running again the most. He's been here 19 years, I think, now, isn't it, Ron? 20. Wow. I wasn't even born then. I'm not fooling anybody in this crowd, am I? Yeah. It's good to see all of you here. I think each and every one of us has been impacted by the fact that we Americans are aging, whether it be a parent or someone in our family who's already in their 80s or 90s, or the fact that we are in what they call the baby boomer generation. And if you didn't read the headlines, the first of us, baby boomers, turned 65 January 1st, according to the record keepers. And we are turning 65 at the rate of 8,000 a day. So we're a very large group of folks. And so we had this notion that we should listen to what some of the experts have to say about the aging process in America, how it will impact us as citizens, as communities, and how we can be better prepared for that. And from our perspective as a city, how we can be prepared and what services we need to know to offer as our citizens age in Temecula here. And so we have, as I said, a distinguished group of panelists today. I'm going to tell you their names as best I can. Dr. Sanjay, and goes by Dr. B, so when I get there, I probably won't try to butcher his last name. And I'll give you a little bit of information about each one of them, a bio, if you will, but I'll give you the information after each speaker. I'll tell you about the next speaker, because it'll be a lot to remember. These are some very well-educated folks and highly experienced. On the panel today, we have Michelle Willman, Deputy Director of the Office of Aging. We have Dr. Amy Carney, Assistant Professor at the School of Nursing, Cal State San Marcos. We have Dr. Kathleen Winston, who is the Dean of Nursing Allied Health at Mount San Jacinto Community College. And we have Dr. Sanjay Bojraj, did I say that right? Okay. Interventional cardiologist, Sheep Heart Center medical group. And I'll start with Michelle Willman. And each speaker will speak for about 20 minutes. They have PowerPoint presentations, and we should be wrapping up around 5:30 or so, a little before that. And at that opportunity, at that point, there'll be an opportunity for you to ask questions. The questions will be written on cards given to me, and then I'll read the questions, and we can ask our panelists to try to address your questions. So, beginning with Michelle Willman. She serves as the Deputy Director, Riverside County Office of Aging. Michelle brings more than 20 years of public social service experience, including 15 years with Adult Protective Services and combating elder abuse. Michelle believes knowledge is power, and education on healthy aging is critical with aging trends in our community. Today, as Deputy Director, she focuses her advocacy to influence public policy for older adults to preserve the further erosion of community-based programs that are their safety net. Welcome, Michelle. Thank you.
Thank you so very much. I have a PowerPoint today, and I'll just begin by saying I think it's a tremendous honor to be here because the city of Temecula is looking at these aging trends, and I think that that's an amazing accomplishment. One of the things that's happened, in 2005, there were a poll around cities across the nation in terms of MetLife worked with the National League of Cities and the National Association of Counties, the National Association of Area Agencies, and at that time in 2005, only 46% of the communities across this country were even looking at these issues of aging trends. So congratulations, and thank you so much for having me here today. So I have a PowerPoint, and I understand there's some questions. We are an area agency, and there are 33 of us in California, and there are area agencies across the United States. And our appointment came from our Board of Supervisors. We are a county department in 1974, and we've been providing programs and services under the Older Americans Act from that time. So we have quite a history in terms of working with older adults, and so we'll tell you a little bit about why we're certainly concerned and why we believe working together with all of you is going to make a difference. So I heard a little bit earlier the comment about the boom, if you will, and it's absolutely correct. In January of this year, folks began turning 65. And so what that really means for us, he mentioned 8,000 persons a day. That's about 330 people an hour, and that's actually about every 8 seconds. So when you think about our country and our community, what's that going to do in terms of all of the things that are important in terms of community supports? So what do we talk about when we say boomers? We're talking about persons that are born between 1946 and 1964. And it is quite amazing because in this rate of that birth boom, there's what they call shadow or bookends. So you have the earlier those persons born closer around in 1946 and thereafter really identifying with boomers. And then you have the later on the other side of the scope, quite different and born in around the 60s and ending in 64, really identifying not so much as baby boomers, but actually as the next generation, the Generation X. So it's almost as if we have a difference within. And so obviously the perspective about everyone's experience is definitely different. So in other words, in the older boomers, those were stay-at-home moms commonly, and then you also have within a generation latchkey and different types of experiences. And so today we're going to say that we have 77 million strong for baby boomers. Some of the newer information is that's a little bit higher, so however you want to look at it, if we look at the year 2000, there were about 36 million boomers, and that's going to double. And so that's why we think it's so important as communities that we start to talk about what that's going to mean for us. And one of the things that we think is really interesting about baby boomers, there's one thing that we all have in common if we are baby boomers, and that's really that medium called television. So today we know that information, just like I'm sitting in this wonderful and this beautiful site in terms of technology, there has been tremendous growth. If many of you think in terms of how technology's changed, I'm sure that some of the panelists will probably talk about that because it is just one of the many factors. So our California population is something that's very significant. How many of you think that more senior citizens or older adults are living in Florida? Because oftentimes when I'm out talking, they say, yes, Florida has, and no. California is home to more older adults, and California's population in general is growing at a very alarming rate. So our population is expected to increase by 172% by 2040. So as you can see, we're not just completely in terms of our older adults, our general population is really growing at a tremendous rate, which is really going to impact. But most importantly, those individuals that are our oldest Californians, those age 85 and older, whose numbers now are going to be projected over 200% growth. So when we think about that, it's funny because Betty White has an interesting, her career is quite active, and one of the things that she says is when you think about when is it that we're getting older or when we're going to be older, baby boomers actually believe that aging begins after around age 75. And so Betty White's version is actually you just add 10 years and then that's getting older. So these are some of the figures in terms of our population that is through the Department of Finance, and I'm sure many of the organizations use some of these, and of course the U.S. Census provides us with a snapshot about what our older adults are looking like across the country. And so one of the things that is of great concern is how this increase is going to affect us, particularly here in Riverside County. And as you can see, we're home to about now 317,000 older adults, and you can see the climb in just a very short period of time. So here we are in 2011, and by 2020, we are expected to have close to 500,000 of persons age 60 and above. So as you know, Riverside is one of the, based on the new census information, the fastest growing county in California, and certainly is way at the top of the list in terms across the nation as a very rapidly growing county. The other thing that is, these are by age groups, and so one of the things that is, as I mentioned, is really the population in the 80 plus. The many years that I spent in adult protective services, we found that the average median age for a victim was age 77, and certainly we know there's more vulnerabilities when somebody is more functionally impaired, and we know from some of the statistics afforded in terms of the Alzheimer's Association and some of the work that's being done is certainly those likelihood of dementing processes actually increase dramatically when we're into that age group. So that's something to think about as we look through the rest of the presentation. So as I mentioned, we're aging, and sometimes folks are talking about this as we call it the maturing of America. And it's a global issue. It is not just in the United States. About 8% of the population in the world are folks over 60, and that is going to continue to move in that trend. And one of the other interesting things in terms is that, as you know, and we're going to talk about a little bit as we go, I'm sure, with our esteemed physician and some of our nurse practitioners, is how we're going to age and what that impact's going to be on the healthcare system and many of the other systems. The one very important factor in terms of the boomer population is, when we talk boomers, is how diverse. And we talked a little bit about experience, social experiences, but also in terms of ethnicity. And in terms of our previous generations, we are going to actually see a tremendous growth, and that's going to really impact all levels of service. So what does that mean when we're providing social service, mental health services, health care? Those unique experiences across those differences are going to actually really affect all of the delivery systems in which we're working in, and we're going to need to be sensitive to this really changing shift in terms of our population. One of the things that is really also of importance is that we do know that in terms of minority populations, some of the factors in terms of chronic disease are affecting in sometimes more drastic in terms of like heart conditions, et cetera. So this is probably something that I'm sure the panel will speak to, but it definitely is going to, in terms of access to services and things like that, have a great impact before us. So what is it that is really going to affect us? Well, we certainly know our infrastructure from the times that you see as you drive through our interstates and you see the roadways and the hospitals and you see housing. We know that today one of the major issues is dealing with this Great Recession that was officially named in December of 2007. So at a time that we have this most impact in terms of aging in place, aging population, we also have a tremendous financial and budgetary that I'm hearing issues in terms of California's budget even today in terms of how that's going to impact the level of community-based programming. And so the community-based programs, as I mentioned, I'll talk about what does that mean, because many of those programs certainly today are impacted as a matter of fact in terms of what was here just 5 years ago. So some of the tax credit programs, some of the community-based programs in California for older adults were actually eliminated in some of the prior budgets. So one of the things that we find that is very important is many times people believe that, and it is true that baby boomers actually, from the time that they entered public schools, and then actually there was more competition for jobs, and then now as we'll probably redefine how we're going to be aging in terms of healthcare, managing chronic illness, our leisure activities, I heard, is there's a tremendous change in the sense that oftentimes we think, well, boomers are absolutely healthier and absolutely going to have plenty of money and retirement and things of that nature. And that isn't actually, it is true, it's one of the myths, because we are living tremendously longer, and that is expected to continue. However, we're not necessarily living healthier, and I think that's one of the most important things today is that it is estimated that really 70% of healthcare is really about self-care, and it's really how we as individuals and as we as neighbors, family members, caregivers, and in the community can impact how we're going to manage chronic illness, and that's going to be a tremendous, we see as a solution as we move into the future. So people believe that boomers have medical insurance, they have long-term care insurance, and that everything is set. So certainly you can see where that phenomena, that recession of 2007, we've certainly seen folks that absolutely have had to re-enter the workforce. Many folks decide that it's more important to stay in the workforce, and we know that staying engaged and staying connected absolutely has those health benefits. And we certainly see boomers as a solution as we move forward when we look at that infrastructure, particularly Social Security. How many of you have received a notice from Social Security that said, well, now the oldest boomers are allowed to retire at age 66. However, if Social Security continues at the present status without some type of support, that by the year 2040, there's only going to be 74 cents on every dollar. So in other words, there'll be more people retired and actually collecting benefits than they'll have workers actually paying into benefits. So we certainly know that we see as the solution is actually staying engaged, and you know that there's many discussions around, well, what is the right time to retire, correct? So I talked about longevity, and one of the important things is that persons reaching age 65 have an average life expectancy of an additional 18.6 years. That's combined. Females, actually, you're more likely to outlive the males, so, and that's another 19.9 years, and for gentlemen, it's 17.2 years. So one of the things that we also know is a great phenomenon is that we have today many grandparents raising grandchildren, and particularly as we are living longer and we're managing retirement, we're managing those kind of decisions as we're aging in place, we're also continuing to see an increase in grandparents actually returning to parenting and actually raising grandchildren. So today we nearly have 18,000 grandchildren under the age of 18 being raised just here in households throughout the county of Riverside. And the ARP is doing, as you know, they're doing quite a lot of work right now. They're very active amongst many things, and one of those are our entitlement programs like Social Security, like Medicare, like Medicaid programming. And one of the other things is that they've been very instrumental in looking at the boomer trends. And so one of the we believe is good to get the information out is that in terms of this as a whole, as the whole cohort, many boomers do not have realistic plans to replace their income as they retire. So we hope that with series such as this is something that we like to say aging is a lifelong process. It begins at birth. It isn't that someday we just wake up and there we are, we're an older adult, we're a mature adult. So in terms of planning, it is such an important thing. Many of you probably have family members that actually plan a wedding. So if you've had sons, daughters, yourselves have weddings, you know that the amount of time that goes into planning that wedding is upwards of maybe a year. But yet, many oftentimes, when in terms of retirement, people have not set those plans in motion. So we like to think that if we can actually work with all of us younger, we need to really begin those discussions earlier as we are growing up in terms of education, so that it's something that we're preparing for all along. So one of the major impacts I mentioned was living with chronic disease. And one of the very important things that we can do in terms is, and we like to talk about a self-empowerment model, about being in partnership with your physician, and we are exploring some different types of programs called care transitions, and we're working with a number of hospitals in Riverside County, where we really see that part of the solution is all of us taking responsibility in terms of our own, managing our own chronic illnesses, and then assisting those persons that we know as well, because therein lies some of the issues before us. Because today, there truly isn't probably enough hospitals. We certainly know that there aren't enough geriatricians. There's only about 1 per 4,000 in the state, and that number is definitely going to rise. So if we're thinking about that 2030, sometimes you'll hear folks talk about the 2030 problem, and really what that has to do with is going to be managing this whole cohort in terms of managing chronic illness and the health care and the challenges that we have before us. So in 2030, 6 out of every 10 boomers will have more than one chronic condition to manage, such as diabetes, arthritis, obesity, heart disease, cancer, hypertension, and high cholesterol. So about 75% of our funding is really spent on 5 chronic illnesses today. And so coronary artery and depression and diabetes are definitely 3 or 4 of those critical areas, and those really are going to be something that are more important. So we certainly want to talk about how the things we can't choose our parents, but we really can alter our lifestyle, and we can make behavioral changes about how we live our life, because the secret, if you leave here with anything today, the secret is how you live your life is how you will age. It really is. It's a very important thing that, yes, there are certainly genetic, and I'm sure the physician will speak to some of those issues about those things that you don't have control over, but there are many things that we do, and that will make a difference in terms of how we're going to manage illness and how we're going to age into the future. So when we talk about the healthcare system, there is certainly going to be more patients in our history, and these are the 4 big areas that have been identified from the American Hospital Association. Certainly there's increased utilization of the healthcare systems. We certainly are going to see a rise in chronic illness. There's different needs and patients' expectations. So we like to say that, as you know, boomers have been very instrumental in many movements, some of the civil rights movements, some of the things that we are afforded today. So we think that one of the things that is going to happen is, as boomers now are caring for loved ones, and as they're aging themselves, is there will be tremendous impact in that healthcare system in general, because of what people will really see in terms of increased utilization needs and what in terms of services they find to be necessary. So I mentioned earlier about the medical coverage. Some of the concerns have been wherever you are on whatever side about the underinsurance, but we know that in terms of this great nation, there is definitely an impact in terms of the healthcare reform and what is that going to mean, and certainly the impact that's happening to the Medicare system, the Medicaid system, and public policy and programming and decisions are really now being impacted by 2 things: boomer, and then also the recovery, or our slower recovery from this recession. So one of the things, for the many years that I spent in adult protective services, how many times do you think that I met someone who said, I really want to live, and when I get older and when I need types of supportive services, I want to go to a nursing home. I haven't yet met anyone who have told me that that's where I really want to go. And so one of the things that we know is really there are definitely going to be long-term care needs that are very particularly in demand. We see a rise in assisted living type of situations and different types of senior living, but we certainly know that really having community-based services for individuals, and then also having that ability for access to services when you need them, are really going to be part of our critical solution. So when we talk about the change, caregiving is one of the things that really impacts boomers. About 11% of boomers today are helping an aging parent. And so we certainly see that that trend is probably going to continue. 75% of caregivers are women, and although that is definitely starting to change as well, and we certainly will know that we have lots of more caregivers as we move forward. One of the interesting things the Older Americans Act was passed in 1965, and it really started as a nutrition program. And one of the things that we see today is that just 10 years ago, we really celebrated, and on a national policy level, there was a caregiver program that was developed called the National Family Caregiver Program. So you can see how really in its infancy it truly is, and how important that this will continue to be as the boomers are aging in place. The MedLife study in 2010 is telling us that about 6 out of every 10 family caregivers are employed. So you have, multiple layers. You have people employed in the workforce and also providing care. On average, caregivers dedicate about 20 hours per week on caregiving for older persons. And really, family caregivers are our foundation of our long-term care system. It really is not the nursing home or skilled nursing care. It really is nationwide. Long-term care is really provided by our family caregivers. And in California, the caregiving, that comes to about $48 billion. That's quite an economic, tremendous savings in terms of making sure that people have the supports they need. So one of the things that is important, I think, to talk about in terms of us as the area agency, it isn't always the dollars that we all know that we're all doing more with less, right? So I think it's an opportunity for some creative thinking. We're talking about livable communities, and we're also talking about bridging the generations and meeting people as they move forward and providing with the community-based services that they need. And so one of the things that is primarily of importance is that we have an opportunity to work together and collaborate, because as we know, the financial piece there is going to be tremendous need. And really, over the last several years, what has happened is funding has been in terms of either folks are holding on, if you will, or they've called it flatline. So it hasn't really increased in terms of providing additional dollars in terms of those community-based types of programs like meal programs or those kind of medication management and case management and things of that. So what's going to be most important for us is thinking about programs, for example, that are creative. One of the things that we have done at the Office on Aging is created for disaster planning is a 911 cell phone program. So we work with community organizations, we work with cities across Riverside County. Older phones are donated so they don't end up, they are recycled, and then they're reprogrammed with a company, and we provide those to seniors in need. And if they have a fall, or we have an emergency, or we have some type of a disaster, a natural disaster, they'll have the ability to dial 911. So we have targeted, and the SCAN Foundation has provided us with some additional funding, and so those individuals who are isolated or homebound are calling, and we make sure that we provide them with those cell phones. So that's just one creative idea that doesn't take a whole lot of dollars, but yet will have an impact in a community to help older adults, particularly those who are more isolated or homebound. So I want to thank you for allowing me this opportunity, and I'm sure there'll be some questions as we move forward.
Thank you, Michelle. Our next speaker is Dr. Amy Carney. She's the Assistant Professor of School of Nursing at Cal State University, San Marcos. Dr. Carney has been a nurse practitioner for 15 years. She has an adult and geriatric certification. She is the holder of 2 master's degrees, one in nursing and one in forensics. And she has a doctorate from University of San Diego. Welcome, Dr. Carney.
Thank you. Thank you so much for having me. I'm so happy to be here. Wow, the academic perspective on gerontology and the elderly, it isn't as dry as it sounds. It'll be fun. No one will nap in my ivory tower. Actually, if you visited our campuses, you know we don't have ivory towers at Cal State San Marcos. We have 2 very active campuses, one here in Temecula and one down in San Marcos. And we're very, very busy in our diverse ways and in our faculties coming together, putting together a very proactive stance on these topics. So elder safety in an aging America, what matters most? What matters most to us? Is it health? Is it our health? Is it being able to stay in your own home, as Michelle said? Insurance? Is it safety? What matters to me may not be the same thing as what matters to you. My mother used to say, someday you'll have to put me in the home. And I would say, no, Mom, you're already at home. We're going to stay here. And that was her priority. But my priority was her safety and her care, and that's what I was worried about. So somewhere along that great divide, you have to come together and decide what your priorities are. Where are you going to meet them? So what have we learned? Academically, what have we learned? We know that congressional hearings were first held on elder abuse and elder safety in the 1970s. Now, the English were way ahead of us on this. When they first termed it granny bashing, they were talking about it a good 15, 20 years before we ever opened our mouths about this. And let me say that I just think elder safety topics now are where we were 20 years ago with domestic violence, where we were with child abuse, animal abuse, those beautiful and heartbreaking commercials where Sarah McLachlan sings "In the Arms of the Angels" and the sad-faced puppies come on the TV and everybody goes, oh. I don't see that happening anytime soon for elder safety. I would love to have that happen, but it's not going to happen anytime soon. Studies had examined circumstances around abuse, tools for examining abuse, detection, theories of causation, but we didn't really understand the relationship of what was actually going on in our homes. So I undertook a study to find that out. The National Elder Abuse Incident Study is where I got a lot of my information. Looked back at the year 1996, when all these investigations were just in their infancy. And they thought that about 450,000 persons over the age of 60 had experienced some kind of threat to their safety back in 96. This is what was reported. This was the tip of the iceberg. So advocacy groups became formed, organizations, we were getting on top of this, and nurse practitioners like myself, were found to be in a unique position for advocacy and change in policy. We were seeing these elders. I see them all the time in my clinics. We see them in our ICUs and ERs. We were seeing what was going on. So what I did was I looked at battery and abuse in the elderly, a forensic analysis. Forensics is the application of science to law. It's not CSI. Oh, how I wish I had just a little bit of their budget and I could take care of everything in an hour. I would love to do that. Forensics is the application of science to law. I'm a member of the American Academy of Forensic Sciences and the National Coalition for Prevention of Elder Abuse, NCPE. And both of these groups are very determined to see, as I was, how this was happening and what was occurring. So what I did, and anyone can do this, you can walk into your local courthouse and ask for the records. Once something has been finished, a court case, for instance, has been finished, and actually sooner in a lot of court cases, that's public domain. You can walk in and ask for any case and look at anything you want. Now, in our case in San Diego, where I undertook this in the district attorney's office, Paul Finkst, our district attorney in 1996, put together an elder abuse unit. Our DA now is Bonnie DeManis, and Paul Greenwood's in charge of that unit. And what they do is they prosecute cases of elder abuse. So I went into the courthouse basements and spent many hours going through records, looking at who did what to whom. And what I wanted to know was, is it family? Is it not family? If we know this proactively, we can protect our adults. And what were they doing? Specifically, I looked at physical, sexual, and financial abuse. Neglect is very hard to prosecute unless it's an egregious form of neglect. And there are some other areas, too, that are hard to prosecute. So I picked the big three. Definitions across states vary. Definitions have a lot of common aspects: overt acts like physical abuse, omissions like failure to properly care. Some focus on cultural aspects, such as disrespect. In the Asian community, disrespect is a horrible form of elder abuse, and yet I didn't see one single case through our district attorney prosecuted on disrespect. And the definitions vary state to state. But here in California, per our Welfare and Institutions Code, elder abuse is either physical or financial, it can be neglect, abandonment or isolation, abduction, such as kidnapping, or other treatment resulting in harm, pain, or mental suffering, or the deprivation of care that leads to physical harm or mental suffering. In addition, our California Penal Code finds that crimes against elders or dependent adults deserve special consideration. Elders have assets. If there's one thing you walk out of this room with, please take that with you. Elders have assets. You've got something, and I want it. I don't care if it's your checkbook, your social security card, your house. Anything that you have could be taken away from you. And this is one of the things I found over and over and over in the cases that I looked at. Whether it was just by chance, the plumber happened to be there and the checkbook disappeared, or whether it was by conniving and cunning when the son stole the house out from under the father. Elders have assets and someone's going to go after them. So I looked at about 155 cases. Now, if I can walk into a couple of courthouses and find 155 cases pretty much like that, you know how many more are out there. And these are the ones that were prosecuted successfully and found to have elder abuse aspects. These are not the ones that get thrown out for drugs, not the ones that were found to be on the edge. These were true blue cases of neglect and abuse. And as you can see, 81% of the time it was financial. 81%. Now, those percentage overlaps come because sometimes they were also prosecuted for physical and financial abuse, financial and sexual abuse, but above all, it was financial abuse. And I found with statistical significance that financial abuse is more commonly committed in San Diego in these cases by non-family members, while physical abuse was more commonly committed by family members, and that was usually the son in my study. So what this means is these people were not walking down the street and got mugged. These people were in a domestic living situation where they had something taken from them. And how do we prevent against this? We have to ask good questions. We have to be willing to talk. In many of the cases that I looked at, I found that even though something valuable was missing, jewelry from the table in the nursing home by their bedside, or their purse off the front table, they didn't want to say anything because they would get taken out of their home. If I tell you, you'll make me go live someplace else. It's a huge, huge discussion we have got to start having. We need to learn to say this. It's even better to do a background check. There are lots of caregivers in Southern California that are not background checked. This needs to change. We need to know where those medical assistants come from. There was a series of cases that I did through this research study where the medical assistants just went from nursing home to nursing home to nursing home, stole everything they could get their hands on, and moved on. And pretty soon we'd say, "Where's Mother's wedding ring?" And one of the daughters actually went to the pawn shops in Carlsbad and she found the wedding ring. And she traced it and she took it to the cops. She did the detective work where no one else could. And we have to pay attention to our instincts. If you think something is hinky, it probably is. Ask those questions. Gavin DeBecker wrote a wonderful book called The Gift of Fear. I don't know how many of you know it. When the hairs on the back of your neck stand up, there's a reason. We need to pay attention to those instincts. We can protect our elders by being proactive and paying attention to our instincts. Implications for education. Down at Cal State San Marcos, we are very collaborative. We are very interdisciplinary. Our psychology department has published a paper on elder abuse. We're going to be very active. We'd like to see ourselves move forward the way that UC Irvine has with their Center of Excellence under Dr. Laura Mosqueda. We need to learn as much as we can. Rights, conservatorship, wound identification, we need to put these things in our curriculum. We need to know elder law. We don't have to have a law school to understand elder law and what we can do about it. Cultural awareness, we've already spoken about diversity. Michelle spoke on that. We know that diverse aspects of our population as we grow in age are not all going to grow and age the same, and we have to understand that. Again, not everybody grows up and says, "Yeah, put me in the home. I want to live there." We don't do that. So we're going to have time for questions later on. Again, please remember that we have to have these discussions. We need to talk to one another. We need to talk intergenerationally, and we need to be very proactive about where we see ourselves going, all of us, not just at my age, not just at your age, but from the steps that we take here today and the steps as we move forward are going to lay that foundation for the future. Thanks.
Thank you, Dr. Carney. I found a couple of things you said very interesting. We just moved my 84-year-old mother-in-law into a CASA, somewhat assisted living facility down in San Diego. She's not real excited about it, but my wife and I, who are both seniors, thought it looked like a great place to live. But my wife won't let me go, so there. It depends on your perspective, and how you view those things. I see having someone cook all the meals and no yard work as as a real plus. Yeah. We have cards to be filled out if you have questions, and I know that as the speakers speak, questions will come up. If you didn't get a chance to get a card, Aaron Adams, our assistant city manager back here, has some. You can raise your hand, and he'll bring you one. And at the end, we'll take all the questions at once. Thank you again, Dr. Carney. Our next speaker is Dr. Kathleen O'Grady Winston. She's the Dean of Allied Health and Nursing at Mount San Jacinto College. Previously, Dr. Winston served as president of National Polytechnic College of Science, an affiliate of National University System in San Diego. Dr. Winston also served as Dean of Health Science, Human Services, and the Emeritus Institute at Saddleback College. Dr. Winston completed her doctoral coursework in nursing and educational leadership at the University of San Diego. She also received a Master of Science from USD in Family Health, Nursing, and Nursing Education. Welcome, Dr. Winston.
Thank you. Like my colleagues, I'm delighted to be here, and I can tell you that one of the things that we know as academics is that you have to hear things more than once as reinforcement of your learning. So you will hear some things from me today that sound familiar from our previous speakers. But I thought maybe at this sort of halfway point, it might be nice to hear from the YouTube, because as part of our aging generation, we want to stay fresh and connected. So I am very grateful to Jonathan Hall, the IT expert here, who has figured out how to insert the YouTube presentation. So sit back and enjoy this for a few minutes, and then I'll talk to you a little more. Thank you, Jonathan. excuse me, the advertisement at the end is not supported by myself. I just felt that it did a beautiful job of, first of all, demonstrating the importance and the value of our connectedness with both technology and our world as we continue to age, and also really nicely encapsulated much of the discussion. The title of my presentation and slides is The Economic Side of the Aging Population. And as I thought about that, being a nurse and an educator primarily, I thought, well, I know lots of things about budgets and money, but most of what I know about the economic side in great detail is probably as limited as the day, because we know that every day we hear different news and pretty frightening news for us. So what I thought I would do after showing you that video is talk a little bit about some of the trends that are the common ones that we hear, and maybe hopefully identify some of the possibilities that will come from the trends and the problems that result from those trends. As they indicated in the video, there's a ratio of current Medicare contributions that's significantly higher than future contributions. In other words, you've got 76 million baby boomers and only 46 million Gen Xers. So we know that Medicare was funded by us working. And the Gen Xers are not happy about this, let me tell you, because there are fewer of them who are going to be able to build the Medicare's resources, and therefore that is the basis, the basic math of why the Medicare situation is in the state of crisis that it is. By 2025, the ratio of taxpayers to pension receivers will decrease to 2 payers for every Social Security. So again, if you're a worker and you're paying into Social Security, it is going to decrease significantly. It's going to decrease significantly with that change in our population. And currently, the deficit is about $3.2 trillion in the Social Security. One of the concerns that I had with one of the concerns I had in preparing this presentation is that all we have to do is turn on the television and we hear numbers like millions and trillions and trillions and billions, and it becomes almost it almost numbs us to what that really means. So I'm trying not to give you too many of those numbers in this presentation, but rather to sort of help you understand that these are real problems that we're hoping we will have some more practical solutions for when we apply it to our own individual experiences and lives. The over 65 population, as you've heard, will triple between 1980 and 2030. That's from the American Hospital Association. And as we all know, if we haven't learned it yet, boomers started turning 65 January 1st. And that we have 37 million boomers who will soon, before 2030, but by 2030, be managing more than one chronic condition. And the numbers there are 14 million in diabetes, 50% estimated in arthritis, and 21 million estimated as being diagnosed with obesity. The important factor here is that myth again, that because we're boomers, particularly the younger or the early boomers, are perceived to be healthier. And there's yet another whole term and that is now contributing to the medical costs, and that is what's happened with younger boomers. It's called boomeritis. And in an effort to live in our world of denial and our fear of aging and some of those emotions that go with that process, is that there's another population that's exercising a lot and that's trying to push to live this healthy lifestyle. And what the orthopedics are finding, and the general practice physicians and the urgent cares in the emergency rooms, is that boomers are coming into those areas with injuries that are related to over-exercise and overuse, because they're not even doing the exercise practice of their healthy lifestyle in a manner which will be healthy and create a balanced, active lifestyle. So we look at chronic illness. One of the problems with everything's a gift and a curse, and one of the gifts of living longer and having good medical care is that we are able to live well into our older age, but with that, and we've been able to cure many of those diseases that killed individuals in generations before us, but the chronicity medical conditions are the ones that we will all have to make sure that we're addressing, and that will increase the cost of healthcare or contribute to that. The problem's been really clearly identified. I love to talk with younger generations when we have those intergenerational discussions, and they're really quick to point out, well, you overspent, you didn't save anything, and you're totally unprepared for retirement. So kind of duh. And it's that expectation that the boomers came from this generation that was before them that wanted us to be able to have all of the things that they were not fortunate enough to have. And as a result, perhaps, we didn't learn some of the lessons along the way about spending, failing to save, and being prepared. 1 in 4 boomers, as you can see, has saved nothing for retirement. And most do not have a traditional pension plan. The pension plan of the private sector that existed in the generation before us does not exist because the economic times has not been able to support that. And we have lots of discussions about where are the public pensions and how underfunded are they. Another problem certainly that contributes to the economic concerns of us as we age, not only to the general population, is that the economy is struggling. And again, every day there's a different piece of information. In our own state of California, we've passed our local Mount San Jacinto College budget. It's a very fiscally well-managed community college, and yet every day, depending on what comes from the state of California's office, we have to make adjustments to what is going to happen in the fall. So keeping that in mind when we think of the impact on education, that has an indirect impact on our aging and on our health care, because that's one of the places where we prepare those people who are going to replace us in all of those arenas. And again, the current economic struggles impact our state and our local governments because they're unable to pay the benefits that workers were promised, and we have all of the discussions about entitlement and certainly the increasing expense of medical costs. Ooh, there I go again. Boomers' current contribution to the healthcare system decreases, but their expenses for care increases. So in other words, what we contribute, again, based on numbers, as we get older, is lessened by our removing ourselves from the workforce, and yet our need for care is, even in the early boomers, as I mentioned with boomeritis, is causing a greater need for services. One of the things that I found really important in the discussion of trends is that this is really a global problem. It's across the globe, and developing countries that we hear about even now are going to be looking to us, a developed country, the United States, to assist them. Japan has the oldest number of all the countries in the world have the oldest number of seniors in the world. China is fast approaching that, and these countries are countries where there's close living quarters and where there are great concerns about the cultural impact of how those aging people will live in those societies, and they're looking to the United States, as many countries do, for many issues and many things, for leadership and guidance. Boomer women, though I, as a younger boomer, am part of that I Am Woman, Hear Me Roar generation, and we know that we've had busy and full careers, but still, there's a lot, when we talk about the general trends, there's a significant number of women and minority groups still who have had limited employment opportunities. And when we look at that larger boomer generation, or the olders, many of those individuals, as was indicated earlier, were primarily stay-at-home mothers, and therefore did not contribute into some of those entitlement systems. So they were pretty much financially underprepared to leave work. So if there are individuals who are working in those two categories, they may not be in a position where they can leave work. And again, most do not have traditional pension plans. And then finally, I thought, what are the employment problems that surround us as we get a little bit older? You know, we're going to retire later. It means we're going to compete with the young generation X and Y and the millenniums, and they're expecting us to be good parents and do as our parents did and retire and make way for their future. In addition to that, however, we're going to have to look for finding new opportunities, and therefore the new opportunities are going to cause us to have to make sure that we are keeping in step with the progress and the technology. We're going to face health conditions that interfere with completing tasks. I'm not sure how many of you saw me walking around out there, but I had a fall. I tell you, it's not an elder fall. And I'm wearing a boot. And it's been an excellent, even as a nurse, opportunity for me to remind myself how limited you can become when you have something as minor as a sprained ankle. And so when you think about those chronic conditions and the impact that those will be having on our lives, these are really important considerations for us. Again, the majority of nurses and physicians are over 40, actually 50, and we need to replenish that workforce. You know, I'm proud to say, and I know my colleague from Cal State San Marcos is proud to say, that we're doing a really great job of trying to prepare nursing and health sciences, allied health professionals of high quality to replace those of us that will be looking toward retirement, because each one of them will be taking care of us. And so we know that there's not going to be enough healthcare workers to meet the demands of the over 65 population. One of the things that's really going to be important for us to consider as we look at healthcare delivery is making sure that we also look at that younger population of boomers who are really going to be maximizing ambulatory care facilities and outpatient facilities, and we are individuals who will manage our healthcare differently than the way healthcare is currently being delivered. So the acute care facility and the healthcare delivery system will start to look differently, and all of you need to be a part of how you want that to look and helping us construct that in terms of policy and changes. But there's a lot of possibilities. You know, as I watched that video, you know, that music was quite dramatic, and it sort of got your attention, and there was a little rapping in the background, so it made me feel like I'm still right there with all those young people. But the reality is, all of that news, as I was watching some of that really rapid fire of information, really leads you to a place sometimes where you contribute to the depression statistics, where you think, what is going to happen, and what are we going to do? But the reality is there are a lot of possibilities. We have to remember that the boomers will have been the generation that have been the single largest and most dynamic force in much social, economic, and political movement in this country, regardless of where they fall in their perspective. So we know that we have that empowerment and that drive, and now we're learning how we're going to place it in our aging and our later years. New job opportunities will be, especially in the healthcare and the social service area, that will be. So we need to be the leaders to help define and describe and construct how we want those services to be delivered and what kinds of individuals we want delivering them to us. Remember, we're the best educated and the most savvy seniors of any generation before us, and maybe even for what will come behind us, simply because of our numbers, if no other reason. Businesses who serve over 65 should see increase in revenue. So I suppose if you're thinking about in the second half of your lives where you want to put your own investments or your own energy or your own new job opportunities, it might be in serving your fellow seniors and making sure that you're meeting the needs and the demands. We've been a demanding generation. Remember, we spent a lot, we saved very little. Hopefully we'll learn to adjust and adapt and modify our life accordingly, but it's pretty predicted in trends that boomers, certainly boomers who are able to do so, will continue to spend revenue, continue to spend money. Younger workers will see an increase in employment opportunities. There is going to come a day, we're in a very difficult financial and uncertain time, but even as we talk about the nursing shortage, some of the students graduating have said, gosh, it's taken me longer to get a job than I ever thought. All we hear about is the great shortage. And there's been a delay because people are staying a little longer. However, there will be that tsunami of boomers is going to become a tsunami of retirement, and we need to be positioned for that. There's certainly an ongoing need for research in evidence-based practice, both in healthcare, and I think it's really important for those of us in education to not lose sight of that, so that they can take all of that rather boring and dry research that we often do and create from it the kind of dynamic presentation that that YouTube video presented to us. Federal, state, and your local governments are certainly working to do some reforming of current practice. And again, I think that the best way for success in changing will be to have the community involved actively in the process. Recommendations. If boomers delay retirement by 2 years, from 62.6, which right now is the average, to 65, then many can actually meet their retirement goals. It's a contrast to the people who have saved nothing, but there is an ability for people to still achieve some of their retirement goals. The changes in Medicare funding and private health care insurance, it's ongoing. I wish I could sit here and tell you exactly what you need to do, but I'm not sure any of us are going to be able to do that for quite some time. So again, the importance of understanding what's best for yourself and what's going to meet your needs based on your goals, that reflective, thoughtful planning, that wedding planning, so to speak, would be really beneficial to you as you think about how you want your life to play in the early years as well as in the older years. Social Security, there's going to be a minor reduction in the cost of living adjustment. There's going to be increasing in employee and employer contributions. So if you are still working, and certainly the generation behind us is already seeing that, they certainly do not have benefits, healthcare benefits offered to them in the same kind of way that we have in the past. So perhaps those are the lessons learned for the generation behind us. More effective investments and more effective activism toward, or involvement perhaps, in being involved even at the localist of level as you identify what is this community going to look like for its quality of life. The need for education about retirement options, saving for the future, and debt reduction, that's an ongoing thing, and there are wonderful services through the Office of Aging, through many local community nonprofit organizations to assist in that process, and research programs to fund cures of specific diseases that are often experienced by boomers, and maybe education for us to do a better job of managing our chronic conditions and staying strong and living long. So community-based collaborations and strong outpatient services will be helpful. George Bernard Shaw said that if I knew I was going to live this long, I'd have taken better care of my body. And I guess what I'd like to say is if I knew I was going to live this long, maybe I would also have taken better care of my financial situation. So all of those things together. And I have some references I included for the PowerPoint and for the web, and I just want to thank you again very much for joining us here today.
Thank you, Dr. Winston. And her closing remarks do remind me to share with you that the city has set up a website. It is www.temeculahealth.org. And all of the PowerPoints that you are going to see today will be on that website. So if there's something that you saw that you'd like to review again, we will have it on the city's website of www.temeculahealth.org. And as we grow our content as it relates to health, we'll be adding additional information, not just the aging issues, but other health issues as well to that website. So visit it, give us your feedback, let us know what you think about it. Thank you, Dr. Winston. And our final panelist is Dr. Sanjay Bourgeois. Did I say that right again? Close enough. Dr. B, interventional cardiologist at Shiva Heart Center in Wildomar. Dr. B holds a board certification in internal cardiovascular diseases and interventional cardiology. He is a fellow of Society of Cardiac Angiography and Intervention. He has completed his undergraduate degree at Northwestern University. He graduated from Indiana University School of Medicine and then returned to Northwestern University to complete a residency in internal medicine. He completed his training in both cardiovascular diseases and interventional cardiology at Henry Ford Hospital in Detroit, Michigan, where he was appointed as the chief fellow. Dr. B, welcome. Thank you.
Dr.
You
Bojaj,
guys
thank
moved.
you. Well, as Mayor Pro Tem Washington mentioned, I'm an interventional cardiologist. So for a living, I treat heart attacks, and what causes heart attacks are blood clots. So blood clots are my enemy. So right now, what I invite everyone to do is actually stand up if you can, shake out your legs, shake out your arms. Let's get the circulation moving. That includes all of us. Okay? Don't worry, this is not an exercise class. But before you sit down, while you're all standing, I have a favor to ask of you. How many of you walked to this summit today from your house? Anybody? If so, sit down. Okay, we got 2 people in the back. I think, okay, there's a mobile home outside. Maybe that was the 2 of you. Okay, how many people here drive a car model 2010 or later, or I guess sooner? I guess 2010, 2011. If so, sit down. How about 2000 or earlier? I guess, sit down. Okay. Wow, it's a lot of people. All right, that was a good year for Detroit while I was in Henry Ford Hospital. Okay. How about, where was I, 1990 or sooner? Okay, so I think that sank our battleship. Okay, ma'am, you're still standing right there. What year is your car? 1997. All right, I'm going to come back to you in a second here. Okay. So we're talking here about aging. And I think one of the things that all the panelists have mentioned is that we're not really talking about aging longer, right? Nobody's interested in living longer. We want to make sure that we're living better, right? So what I'm gonna try and do today is give you maybe some actionable items, to use a business word, that can maybe help you do that. So if we can go to the slides. All right, so this is me and all the initials behind my name. All right, so if you look at population trends, okay, we're going to go back a while, all right? When God designed our body, right, we were supposed to be eaten by tigers at about the age of 20, okay? If you lived in the Neolithic period, that was about your life expectancy. And the way that, believe it or not, we can do that is you look at skeletal remains, and you can look at the bone plates in the knees and in the wrists and estimate what's called a bone age. So based on that, archaeologists have figured out that about 20 is about how long you were supposed to live back then. And as society grew, so did our life expectancy. So if you lived in the Bronze Age, great time. Now you have knives, something not made out of wood, right? You might be able to defend yourself against that tiger, okay, or I guess the person next to you. You lived until you're 26. Classical Greek and Rome, so now we have aqueducts, we have philosophy, we have democracy, right? That bought you an extra 2 years. Right? Medieval Britain, right? So now we're in the era of knights and chivalry and all. That got you an extra 2 years, okay? And then between then and the earliest 20th century, something happened. You gained about 20 to 25 years. And you're thinking, now, I think it was mentioned before, it's almost approaching 80 years of age is our life expectancy. So what you can see is that we are by far outliving the design of our bodies. And I think a lot of the chronic diseases that were mentioned are a result of that. You know, God would be making no money if he had offered all of us an extended warranty, right? So that's why I guess doctors come into play. But I think that is, from the healthy perspective, the majority of the issue that we have, right? So we talked about the overall trends. These are just trends in the United States. We don't need to belabor these numbers. But again, you can see that women always seem to live longer than men, right? And but for both, if you look, they have kind of improved linearly over time. And a lot of that is issues of not just, the majority of it is actually public health issues. So just something as simple as washing your hands, or not taking your water out of the same river or downstream from the same river you drop your sewage in, right? That actually helped us out quite a bit. But as medical advancements have been made, we've seen this incredible increase in average life expectancy, but not only that, the improvement in what we call physiologic age. although my face probably betrays it, I've actually been in medical training for about 15 or 20 years now. Okay, and I remember at the beginning of my training when I was a medical student, you had to try and sell a case to a surgeon, right? Well, and this was always happened at the VA hospital. Well, sir, Mr. Surgeon, don't bite my head off, but this is Mr. Smith. He's an 80-something-year-old guy, chronologically, but physiologically, he's 78. And that was supposed to be your selling point. Now I'm kind of advanced in my medical training, and now when the med students call me, they tell me, well, you know, Mr. Smith is an 80-year-old guy, but physiologically, he's 60. And that actually is a big trend that we're seeing. So as the boomer population is aging, taking better care of themselves, of course, there's the set that is and the set that is not. But as we're taking better care of ourselves overall, I think these issues of long-term health care, not only just the funding issues, but also the importance, as Michelle mentioned, of having patients take care or take responsibility of their own health is becoming more and more important, right? And that's what's going to keep us from being this guy when we're 65 to being this guy when we're 65, okay? So, young lady who had the model year 1997 car. Okay, if you could stand up, please. I don't mean to, if you don't want to stand, I don't want to embarrass you or anything, but, okay. So, explain to me, 1997, right? So, that would make your car about 14 years old, if my math is correct, 14, 15 years old, thereabouts? Okay. How did you manage to drive a car for 15 years on one set of tires?
I've had a few tires.
You have?
Yeah.
Oh, okay. How did you get through on one oil change?
I've had a few oil changes.
Is that right?
Yeah.
And one tank of gas in 15 years?
Well, a few more than that.
Few more than that, okay. So how often do you fill your gas tank?
About every other week.
Every other week, right? How often do you get your tires changed?
I check the air.
Okay.
Air pressure.
Whenever, if you're like me, whenever somebody tells you it's time to change the tires, right?
Yeah.
Okay.
Right.
So the way that you've gotten your car, right, healthy for 15 years is prevention, right?
And it's paid for.
And it's
That's important.
well, give her a hand for that. That's the most important part, right? You can sit down, thank you. So strategies from keeping your car from turning into the junk heap to being a classic are the same, pretty much, give or take, as it takes to keep your body healthy, all right? When we look at the top causes of death in the United States, and unfortunately I didn't want to put the top 10 in because the font gets too small and I wasn't sure how big the room was going to be, so hopefully you can read this. If you look at the top couple, as we already mentioned, heart disease is the big one, cancer, stroke, respiratory diseases, including asthma, emphysema, COPD, accidents or trauma, Alzheimer's disease, and diabetes, okay? And of these, if you look at the trends, I would say really the only one that is theoretically unavoidable is the accidents or traumas, right? Anything could happen at any time. But everything else is an issue of prevention. And fortunately, issues of prevention are actually similar for all of these issues. It'd be one thing if I told you you had to do 8 different things to prevent these 8 different issues, or 6 different things for these 6 different issues. But in fact, there's a lot of overlap. So I think the scariest thing for patients is that patients just don't like doctors, right? When you're a kid, when you went to the doctor's office, you turned around and all of a sudden you were getting a shot somewhere. Okay? And unfortunately, that continues. When I go to my general doctor's office, all he wants to do is poke and prod and put fingers where he shouldn't do it, right? But believe it or not, these are issues that maintain your health, okay? So as a cardiologist, I'm going to focus a little bit on the cardiovascular issues, things that prevent stroke, heart attack, things like that, just because that's my bias. But certainly preventative care is a lot more than just cardiac care. There's issues of GI issues, things like colonoscopies that you know about, things like screening for depression. That's actually something that's come up quite a bit. But I'm going to focus on 7 simple things that you can do starting today to increase your general level of health. All right, and this is put out by the American Heart Association called Life Simple 7. Okay, why 7 things? Because looking at psychology, short-term memory is limited to 7 plus or minus 2 cubes, okay, or receptacles. That's why phone numbers are 7 digits. That's why I have such a hard time now remembering phone numbers, because now they've added the area code, so now it's 10 digits, right? That's greater than 7 plus or minus 2, so now I have to program everything into my phone. But 7 simple things that you can do on a daily basis that are not difficult to do, that can help advance your health and activate you as the most important member of your own healthcare team, right? Because I don't care what any doctor has to say. I've talked to my patients till I'm blue in the face, but if they don't go home and do what I ask them to do, then there's no net benefit, right? So what I try to do, rather than talk to my patients, is engage them. And that's what I invite you guys to do, is to be engaged in your care, be a very active member of your care. So these 7 things, and we'll talk about them individually, are get active, control your cholesterol, eat better, manage your blood pressure, reduce weight, reduce blood sugar, and stopping smoking. All right. So getting active. I think in the PowerPoint dance video that we had there, they had mentioned about 70% of the United States adults do not get enough physical exercise. Okay. So what is enough physical 70%? Think about that. That's a lot of people, right? So that's if 1 out of every 8 seconds someone is turning 65 in this room. Is that right? So that means, I don't know, in the country, sorry, not in this room, obviously, that would be a remarkable statistic, but 1 in every 8 seconds someone is turning 65, so think of that. Only 3 of those people out of 10 are actually getting enough exercise. So what is enough exercise? I'm not telling you to train for a triathlon, okay? I'm not telling you to go out and get tennis elbow and visit your urgent care. All we talk about is walking. It's very cheap, it's very easy to do. 20 to 30 minutes a day, 5 to 6 days a week is all you need, okay? And this is dedicated exercise time. I don't want you to go out and buy a stopwatch and say, oh, I walked from the car to the front of the store, click, all right, that adds 2 minutes. I only have 18 minutes to go, right? That's the wrong thing to do. This is dedicated exercise time. You and yourself, you and your spouse, you and your friends, go outside somewhere and walk. When I was in Chicago and when I was in Detroit, I would tell people that, the wintertime, it's very difficult, so go to the shopping malls. Here, I tell people in the summertime, it gets very hot, so go to the shopping malls. But if you do, make sure you leave your purse or your wallet in your car, okay? Because I do not want to be further blamed for the financial ruin of the baby boomer population than I am already, not funding the pensions. And if it's worth it, it'll still be there in the store, okay? You can always go back to your car, get your purse, get your wallet, come back, and it'll still be there, okay? Also, in terms of get active, is mental activity. Okay, so this isn't just physical, this is mental activity. Things like crossword puzzles, find-a-word puzzles, Sudoku puzzles. These have been shown to increase mental acuity and keep you sharp. Okay, it's just like a knife, right? If you don't sharpen the blade from time to time, it gets dull. Similarly with your mind. If you're not challenging yourself, if you're not engaging with people, the mind can become dull. And now, as was mentioned, I think 73% of seniors are online. There are a whole host of communities. Things like online chess, online checkers, online, you name it, it's probably there. So make sure to try and engage yourself in these activities so that average of 123 minutes a day that you spend online is actually doing something to help your mind, okay? Why do I keep blanking this? Sorry. Control cholesterol, okay? What is cholesterol? I think from a public health standpoint, pretty much everybody knows what cholesterol is, and everybody knows that cholesterol is bad. Okay, cholesterol, what it is, it's a measure of a fatty particle that is actually a normal part of human metabolism that circulates in your system. If you have too much of what's called bad cholesterol, or LDL cholesterol, that can actually deposit in your arteries and cause plaque. That's a process we call atherosclerosis, okay? So how can you look out for that? Well, the first thing to do is you need regular visits with your physician, your primary doctor, family doctor, nurse practitioner, physician assistant, whoever it is, and at least get your cholesterol checked about once per year, okay? Based on that, you might have to get it checked more frequently. They might prescribe exercise changes, diet changes, lifestyle modifications, or even sometimes medications that probably many of you are familiar with, called statins, that help reduce your cholesterol. And furthermore, these statin medications have actually been shown to improve or to decrease the risk of heart attack, decrease the risk of stroke, even above and beyond their effect of lowering cholesterol. So they're very good medications and relatively safe, okay? I keep doing the same button there. Eat better, okay? This is not rocket science, right? Do what your mom told you, right? If you, oh no. Okay. Back to the cars, okay? I got a little too excited with my clicker here. So if you are in an unfamiliar town, and these two gas stations are right across from one another, and they have exactly the same gas price, okay, and you didn't need Pringles or a soda or anything that they would have on the inside, which of the two would you go to? Okay, if you're a nostalgia type person, you might want to go to the one on the, on the left of the audience, okay? But most of us, I think, would probably go to the right side for no other reason other than aesthetics, right? So similarly, when faced with these two options, why do we make a different choice? Okay? For those of you whose cars, the 99.9% of you whose cars run on unleaded fuel, how many of you have accidentally put diesel fuel into your engine? I'm seeing a lot of no's, right? Why would you ever do that? If you're like me, you don't know any better, number one. And number two, because the label, when you open the gas tank, says only put unleaded fuel, right? But at the same time, we treat our cars so much better than we treat ourselves. Because this quadruple hamburger cheeseburger concoction is the choice that oftentimes we make, right? When confronted with an apple or a cupcake, what do? Right? The cupcake. And that part of that is biology, actually. We are a calorie-avid creature, meaning that in times of feast or famine, we were programmed to eat the most high-caloric foods we could because we didn't know when the next time food was going to come around, right? So unfortunately now, fortunately, I guess, food has become so readily available that that same mechanism of protection actually works against us, okay? So do what your mom told you, right? Eat your fruits and vegetables. What wasn't mentioned as part of my bio is we moved here and I have triplet daughters who are now 2, and getting them to eat takes about 45 minutes. Because they just don't want to eat. It's just not part of the equation for them. They want to run around, they want to play, they want to do Play-Doh, they want to climb mommy, they want to climb daddy, but eating is just not part of the equation for them, right? Whereas, what did I do last night? Well, I watched TV and I had a bag of chips, right? So only eat when you need to, number one, and number two, eat what you're supposed to. Manage your blood pressure, okay? Nobody has ever felt bad with moderately elevated blood pressure, and that's the problem. If you have extreme high blood pressure, something we call hypertensive urgency or emergency, sometimes people can have symptoms that mimic heart attack or mimic stroke or yet severe headaches that make us think they're aneurysms and things that are bleeding where they're not supposed to. But by and large, the biggest problem with blood pressure is that most people don't feel it elevated, okay? Blood pressure can affect the arteries in the heart, can affect the brain, and can affect the kidneys. And once you start affecting the kidneys, that's like the house, in the house of cards, the card on the bottom. Once you pull the kidneys out of the equation, everything becomes much more delicately balanced. So you have to protect your beans as much as you can, okay? Goals of blood pressure depend on on health status, okay? So are you diabetic? Are you not diabetic? Have you had heart issues before, including heart attacks? Have you had strokes before? Or are you relatively healthy? These are all things that your physician should look at in terms of helping to manage your blood pressure. And believe it or not, remember I said everything is interrelated, okay? So even blood pressure can be affected by things like high-fat foods, your exercise level, and smoking. So all these things are very interrelated. Losing weight, another statistic that was pulled up. Over 2/3 of adults in the United States are considered overweight or obese. This is a staggering statistic, okay? This is 6 out of 10 people, or 6.6 out of 10 people, I guess. But I don't know if anybody of you know a 0.6 of a person, so we'll just say 6 out of 10 people, right? This is a lot, and this is a huge epidemic, okay? If this were... I often tell my patients, if this were Saddam Hussein or Osama bin Laden behind this obesity epidemic, okay, the government would have called this a weapon of mass destruction and something would have been bombed, right? Some fast food chain would have been put out of business. But unfortunately, this is an issue related directly to our own behavior, okay? Weight equals calories in plus calories out, all right? So make sure you're being careful about calories going in and also burn the fuel that you already have. And that's what you have to do to lose weight. With elevated weight comes the added risk of increased risk of stroke, increased risk of diabetes, okay? So again, you can see that these are not things in isolation and the bucket over here and the bucket over here. Everything is interrelated, so it's very important that you take care of these issues. And probably one of the vendors, but if not, I'll be happy to help anybody afterwards, calculate what's called your body mass index, or BMI, okay? This is, though an imperfect tool, one of the best tools we have to define what category of weight people are in, Okay? Are you normal weight, overweight, or obese? And each of these categories carries with it its own set of recommendations and its own set of risks. Reducing your blood sugar. If there's one thing that I'm most afraid of in my life, other than something happening to my kids, it's that one day I'll be diabetic. Okay? Because diabetes is a bad, bad player. All right? Increased risk of stroke, increased risk of heart attack, increased risk of everything. Okay? But additionally, as an interventional cardiologist, when I go in and I take pictures of people's blood vessels that have had diabetes for years and years, the pattern of disease that you see is so diffuse that it actually limits a lot of what we can do. It limits the use of stenting. It limits the use of bypass surgery, okay? Because it's not just one spot that's affected, it's the entire length of your blood vessels that's affected, okay? And again, I'm speaking as an interventional cardiologist, but I'm sure the other doctors in other specialties would each give you their own horror stories about what diabetes can cause. One of the most simple things you can do to watch your blood sugar is just avoid simple sugars, okay? Avoid things like sodas, candy, sugary desserts, okay? You can't go somewhere without somebody having a candy bowl on their desk, or, my office is guilty of this too. We have little breath mints and lollipops and things for patients, but you have to try and avoid that temptation, okay? Because each little contribution that you make adds up over time. And finally, quit smoking. I think that this has been probably one of the biggest public health successes in the last 10, 15 years, is that we've seen trends now where, at least among the older population of Americans, that there has been a remarkable decrease in the incidence of smoking, okay? If you're a smoker, this is the single best thing you can do to improve your health, okay? Even if you never walked another foot, even if you ate sugar all day long, okay? As long as you stop smoking, you'll at least crack a little bit of a smile on my face, okay? Because that's how significant tobacco use can be. Again, as with everything, right? We're talking about vascular health, increased risk of heart attack, stroke, aneurysm, lung disease, and what's called peripheral artery disease, or atherosclerosis, or blocking of the arteries of the legs. Smoking is also a bad player. And I tell people this all the time. Tobacco companies spend millions and billions of dollars making the substance as addictive as possible. So I know it's not easy to do, but keep at it because I promise you're worth it, okay? So just a couple parting shots here, and then we'll open up for questions, I guess. But number one, don't assume that something you perceive as abnormal, all right, is just a quote-unquote normal part of aging, okay? Think about how your health has been over the last decade. And what I like to do is tell patients, think of yourself at holidays. This Christmas, could you walk up the stairs to go get your grandson from his bedroom playing Nintendo so that he would come down for dinner? Last year, were you able to do the same thing? The year before that, were you able to do the same thing? If you note that this time, for the first time, you could only walk up 3 or 4 flights of steps before you got really short of breath, well, that might not be normal, okay? So get that checked out. If it hurts when you walk, this is another thing I run into a lot. Every time I walk in the grocery store from the Fruit Loops to the Raisin Bran, I have to stop because my legs just hurt, doc, but I think that's just a normal part of aging. Well, it may be, but doesn't necessarily have to be, okay? So again, the issues that I'd like to leave you with, number one, is that you are the single most important member of your own healthcare team, okay? You know your own bodies much better than any physician could ever hope to. And if you don't take care of yourself, number one, then it becomes very difficult for others to do it for you, okay? And number two, if you stay in tune with your symptoms and realize that something just ain't right, as we say in Indiana, then get it checked out. All right, and with that is everything I have to say. Thank you.
Thank you, Dr. B. I'm not sure where your presentation fits in with what everybody else was saying, because they were telling us about how baby boomers are going to be this anchor around the necks of the Gen Xers, and you're actually giving advice about how baby boomers can live longer and healthier lives. I think you're going to make a lot of Gen Xers mad at you.
Well, I guess as speaking as a Gen Xer, I'll take them all on for you.
Oh, okay. All right. When I first went to work for Delta Airlines when I was much younger, we used to joke about how we could get the senior guys to retire early or leave so we could move up. You buy them trips, extreme skiing or something that they could hurt themselves on. But
Right.
you're giving good advice about how people can live long, healthy lives. And actually, I'm following most of your advice.
Well, there you go.
Yeah.
Proof is in
but
the pudding.
that burger looked very good.
Hey, that's the problem.
And Aaron and I decided we may go over to Five Guys after this. Thank you so much. Very interesting. I learned a lot. Hopefully everyone here did. I know we have some questions, and Candace is going to bring me up a few. Okay. Our region is home to many retired veterans. Are their aging issues being addressed? That's from Bruce Kripe, retired Marine. Where are you, Bruce? Yep. You don't have to call me sir anymore. You're retired. Who would like to address that question?
Well, I know that in our neck of the woods, and up here as well, I'm a nurse practitioner for neighborhood health care. And we have clinics up here. We have clinics in East County of San Diego and in Escondido. And I know that we are seeing an increase in the VA population. And it's my understanding that VA will see you, obviously, at the VA clinics, and we have one in Escondido and at the VA hospital. But I understand that you can elect to go elsewhere. Is that not true? Yeah, you can. So although we do make those options available, we'll tell you where the VA clinic is. Obviously, we're happy to see you and do what needs to be done. Now, having said that, you present an interesting range of background and diseases that we don't necessarily see every day of the week. Your hearing problems, for instance. See? Yeah. Yeah. Your hearing problems are different because of the way you worked, what you did in the military, what your job was. Quite often we see your musculoskeletal problems are a little bit different from the things you carried and lifted, your knees, your back. So we have to be mindful of that. So I think it's more of that kind of an approach for the VA because you have aged, and you have worked and aged a little differently with your bodies.
Here's another question, kind of interesting. I'm not sure that it's PC, but what is there here for mentally retarded elderly citizens for long-term care? Publicly, I cannot find anyone who offered due to mental retardation. Do we refer to it as retardation anymore, or have we changed the name of that? I'm sorry?
Developmental delay, I think, is generally what we
Okay.
call that particular patient subgroup now.
Does anyone have any experience with that for elderly?
Well, there are organizations, and the inland regional centers certainly are experiencing the same trend as we talked about today. So I would say contact your local inland resource center whose services really have to do with those type disabilities and delays.
Okay. Yes.
And I would also recommend that they contact the American Association of Retarded People, which is an organization that's quite active, actually, in Riverside County.
Okay, great. This one sounds like it's for Dr. B. He says, I'm 82 years young. I've had 3 heart attacks and stents in my heart. I take 2 different blood pressure pills. My BP is still running high. Why?
Or is it now? Hello? Okay, good. Well, that's a great question, and that actually raises a big issue that comes up is as the population gets older, and kind of the mechanism with blood pressure is one of these issues that we're kind of outliving the design of our bodies. But as we get older, the blood vessels actually become stiffer, okay, with time, and that's what drives that blood pressure mechanism. And whoever that gentleman or lady is, I'd say congratulations for only being on 2 blood pressure medications, because it probably sounds like, depending on what the blood pressure medications are at, there's probably a need for a 3rd or even sometimes a 4th blood pressure agent. Blood pressure is one of those things that is multifactorial, and as a result, we have many classes of medications that treat the blood pressure from different angles. So it sounds like, certainly with a cardiac history of heart attack before, history of stents, the blood pressure goal for someone like for like this person would be very aggressive on the order of 120/80, which is, believe it or not, with medication sometimes very difficult to accomplish. Why the blood pressure is high, it may just be a normal part of the aging process, but sounds like some further advancement in therapy or even some different classes of medications would be of benefit.
Thank you. I'm not going to be able to get to all of these because I want to get you out of here so you can enjoy some of the music and some of the food that's being offered. There was a question that was directed to me or to Ron, and actually Ron's the expert on transportation systems. But the question was, what are the plans for increased transportation systems? And Aaron, I don't know if you would you like to try to address that? We've got a couple of the trolleys that are running. We've added some bus routes. Councilman Camachero sits on the board of Riverside Transit Association. What, RTA? I know it as RTA. Do you want to try to address that?
Yeah, Chuck's right. RTA, I believe they were a vendor here. They may still be out there in the Civic Quad. That might be a good question to address directly to them. But they are our transit provider for Riverside County. And I am aware that we do have influence here in Temecula with a couple of council members that do sit on the RTA board in terms of routing, in terms of needs. And so these routes come up for adjustments annually. And so if there's something specific that you need or in terms of transportation and pickups, I would encourage you to contact RTA or maybe go visit them out here in the quad. Or come see me.
Thank you, Aaron. Here's one. It says, I know of a case of an elder abuse. To whom do I report it? And the number is, and can my call be anonymous?
I happen to know that number. The Adult Protective Services hotline for Riverside County is 1-800-791. Oh, good heavens. Now I can't think
I don't
of the
know.
number.
Jonathan,
We'll get it to you.
Do we have the ability to put it up as she says it?
Yeah, as we
1-800
1-800
791.
Let me see if I can't. Well, I'll definitely have that number for you. For some reason, it's not coming into my memory at the moment. I think it's too many digits with the area code. Being a
Area
boomer.
code screws everything up.
You have 6 of the 7, but it's actually 10.
But I'll certainly, and if you visit our table, we actually have a booklet. The Office on Aging actually has a booklet with that number out at the tables, and it'll
Okay.
actually tell you who to call, whether it's abuse in a facility or the Adult Protective Services hotline.
Okay, why doctors don't send seniors to see or refer to a nutritionist if they need it or give more information at their office?
I guess that would be for me. I don't know. Actually, I think that's a great question. I think well, I can tell you that in medical school, nutrition is not something that is focused on very much. We're learning about amino acids and proteins and carbohydrates and this, that, and the other at a molecular level, but I completely agree. I think that a lot of the issue with why patients aren't referred for those services is a lot of physician education issues, meaning physicians need to be educated on that as well. I completely agree, and I'm actually in the process of trying to figure out where to send those patients to, but nutrition is a huge factor in controlling diabetes, and just like I mentioned, those American Heart Association Life Simple 7 goals, is a huge factor in maintaining cardiovascular health, decreasing the risk of stroke, heart attack, for cholesterol issues, and certainly managing diabetes. So I would ask those of you who might know a little bit more about what's available in the county, do we have any services for elders or anybody in general in regards to nutrition services?
I know that down in my neck of the woods at Cal State and in San Marcos, I volunteer at the senior center down there, and they are very into nutritional lunches. Some of you may have taken part in some of your nutritional lunches. The other thing that we do is Project Dulce for diabetes. I don't know if you've heard of that. Project Dulce focuses on people with diabetes and is very heavily involved in their nutrition. We also do have registered dietitians, but the problem is your insurance in general doesn't cover them, and then you have to pay cash. Now, we're more than happy to send you. We have them, but more likely than not, Medicare won't pay for it, and that's the problem.
I'll close with a comment. I'm married to a nurse. She's not a practicing nurse anymore. But I would say that I've seen an evolution over the last 5 to 10 years. She has not been a nurse for more than 10 years, but she uses the internet quite a bit to find out medical information. 10 years ago, my doctor would kind of look at me sort of suspiciously if I said I saw something on the internet. But now, my doctor says, you can look this up on the internet. Here's what you look for. And encourage me to do that. And of course, if I mention it to my wife, she's found it and printed out or sent me a link to my email address, even though I'm just in the other room. She sent it to my email on my laptop, and I'm to look it up what she sent me, and she's done all the research. And I found that I'm very engaged in my own health as a result of that. And then if I do have to make a visit to the doctor's office, I have questions I can ask that are somewhat educated, as opposed to just throwing my hands up and being at the mercy of whatever. So I thought that was good advice. I think you gave us a well-rounded picture of what the aging process entails, what we can look forward to. I appreciate all of you taking the time to be here today with us. And hopefully this will become something we do annually, and we'll have more discussion about aging issues. So thank you again for coming to the city of Temecula. And I'm going to call it a day for the panelists. If I didn't get to all of the questions, I'm sorry, but I don't want you to miss out on what we have remaining as well to offer for you. Thanks again for coming.